Thank you for that very rich set of questions. Dr. Alamayo said, he began his remarks by saying we'll split the questions amongst us. Everett the diplomat, he didn't actually add saying, because I go first, I will take some and I'll leave some of the harder ones for John. Not for the first time, I've been impressed by his incredible diplomatic skills. To work through a number of the questions which I think are particularly relevant to the remarks I was making, a number of speakers have introduced the issue of graduation and have expressed a concern that households which are graduated from the program may be graduated prematurely, maybe are at risk at falling back into food insecurity. On this, I cannot give a strong, definitive, quantitative answer to that question, but what I can point to is that this is an issue that the government itself is also concerned about. Our remit for the 2014 evaluation is to pay particular attention to graduation issues. We've done some redesign work in consultation with the government and with the CSA on the quantitative instruments, which will be used to collect that information. We're doing some redesign work on some of the qualitative instruments. And again, I think this speaks to the strength of the design and setup that the government and donors have put in place, which is by having these repeated surveys of both a qualitative and quantitative nature. As these issues emerge, it's possible in a way to obtain real information and data on those, which can then be reflected in subsequent program operations. The second question came from over here, and I'm afraid I didn't catch your name, but you began by using a phrase saying something about how would you convince governments in other countries about this program. And I think you then went on to ask some questions around issues around value for money. On the question on convincing other governments, to be honest, if in some sense you need to convince another government that they should try this type of design, you are doomed to failure. And I don't mean that as a reflection on your efforts or the efforts of your colleagues or others, but I think it misses one of the essential design features of the PSNP, that this is a program that at its core, it's something that the government of Ethiopia wants. And when I was asked, I think from over here, someone saying, well, can you talk a little bit more about what are the types of investments the government of Ethiopia provides to this? We could talk about the number of people who are employed in different offices, the amount of the capital budget which is devoted to the program, and so on and so on and so on. But that, again, completely misses the point. What really matters here in terms of the government, as it were, resources that go into the program, are not kind of the budget numbers or the machine or the computers or printers that are bought, but more the high-level commitments to making sure this program works, and more the willingness, particularly at senior levels of government officials, to extend effort to ensure these things happen. Across my professional life, I've worked with civil service and bureaucracies in a number of countries. I have had more meetings at 6 o'clock on a Saturday night in Ethiopia with senior government officials than I have in any other country I've ever worked in. And that's a reflection of the fact that at a very high level, there is commitment to make this program work. And this then feeds into the question, I think, that also came from over here about talking about this long-term commitment. Along with the long-term commitments of the government has been a long-term commitment by the donors. And Matt or others can correct me on this, my recollection is the initial donor agreements ran from 2005 to 2010, the second ran from 2010 to the end of 2014, and there's a negotiation for a third phase. What's really striking in this is that these in themselves are long-term agreements. This is not a 6-month in and out type project. Particularly in the first phase, if you go back and look at some of the reports on the operations of the program, to be charitable, they paint a mixed picture. There were parts of the program that were working very well, and there were clearly parts of the program that weren't. And the important feature here on this is that government and donors, drawing on this information, were able to say, well, we've identified gaps in WARDA capacity. It's true we could go and change the program, but those gaps would remain. So let's actually try and address those gaps directly. I think also from over here came a question about involvement in NGOs and involvement of beneficiaries and program participants. On the program participants, Alamayo has already spoken to that. The program design encourages beneficiaries to participate in the selection of public works Initially, in the early rounds of the evaluations, that ran about 10 or 15% of people, and as of 2012, that's now approximately 40%. Approximately 60% of people in areas served by the PSNP attend meetings where beneficiary selection is discussed, and more than 80% of people report that they themselves benefit in some way or other from the public works which are undertaken in their localities, all of which speaks to a high level of beneficiary participation and ownership. You also asked about the role of NGOs. Leaving aside a certain number of areas which receive support from USAID, NGO involvement in the PSNP is very limited, both international and local. I should preface this next remark by saying I think NGOs, both in Ethiopia and elsewhere in Africa and the world, do many wonderful things. I think it's a very good thing that there is little NGO involvement in the PSNP. The reason I say that is the following. If I am a donor, and I'm actually happy to say I'm not a donor, I just can't imagine the lives those guys lead. And I am told by my boss, go out and implement this program and come back in 6 months and show me it's successful so I can go to my minister and say, look, we are doing wonderful things. The easiest thing to do in that case is just to go and find some NGO, some implementer who can just do these things really quickly. And then I can come back and I can I can tick all sorts of boxes that I know all you donors have to fill out on your internal reports. But that does nothing to build local state capacity to either to design or implement programs. My suspicion, and this is more a supposition, is if you look across much of sub-Saharan Africa, and you look particularly below the federal level, you have governance systems which I would describe as being brittle, which is they exist on paper. There might be some people who show up to their office, some places maybe not even that. But when there is a crisis that occurs, they have very little capacity to respond to that crisis. And indeed, to a certain extent, you see that emerging in very tragic form in terms of the events which are occurring in northeast Nigeria at the moment, with the kidnapping of these schoolgirls. A consequence of this willingness to make a long-term commitment into the program is the development of this local level capacity. So when there are localized shocks, such as, for example, droughts that occurred in northern Ethiopia in 2009, droughts that occurred in part of SNNP and RME in 2011, the first line of the response mechanism was actually local government officials who collected that information, who passed it up internally within government, and then within government shared that with donors. So in other words, in terms of these broader themes we're discussing in this conference, there is in some sense you have a governance capacity which is not brittle in the face of shocks, but one that is actually able to respond. And in that context, I say, that has been one of the big benefits of the program of not actually working through NGOs, but working through government structures instead. Someone also asked, and this will be my final point, about nutrition. Nutrition was not on the agenda during the initial phases of the design of the PSNP, or was on the agenda very peripherally, but over time, both government and donors have moved that to a more central position. And I understand there's design discussions going on with the next phase, and my sense is on nutrition issues will become even more central there. What we do know in terms of looking at nutritional measures in children under the age of 5, in terms of, for example, both chronic undernutrition and acute undernutrition, is those rates have remained relatively stable despite these repeated shocks, but they have not improved. One reason for that, and there are again, a multiplicity of these, is that at the moment, nutrition can be described as being loosely wedded to the PSNP. That is to say, there is some co-location of nutrition services, but there is not a sustained attempt to actually link those nutrition services to PSNP beneficiaries. We see that reflected, for example, in the contact levels that PSNP beneficiaries have with health services, with mothers' knowledge about good nutrition practices, and so on and so forth. So moving forward, going from a system where these things are loosely meshed to being systems where they are tightly wedded is one where in fact there can be considerable gains. Tightening the links, particularly between staff and Ministry of Health, and PSNP staff will be one way of accomplishing this. Two other areas also, I think, deserve note on this, or deserve comment. One of which is that the P in the PSNP is productive. Oftentimes we think of productive in terms of roads or natural resource reclamation. But investments in nutrition are investments in production. We know from experiences all around the world that if one wants to attain long-term reductions in poverty, if we want to attain long-term growth rates, then in fact we have to invest in reducing undernutrition. Information we have from other parts of the world indicates, for those of you who know nutrition statistics, that a 1 standard deviation increase in children's height for age Z scores at age 3 reduces their likelihood of being poor in adulthood by 10 percentage points. We also know from calculations my colleague Harold Alderman and I have done for Ethiopia, is that for every dollar invested in direct nutrition interventions, the economic benefits to that, to the Ethiopian economy, are somewhere between $10 and $12. To put that number in perspective, supposing we were having a conversation with the Minister of Finance, and we were to propose to him we should take $100 million of resources and put that into direct nutrition interventions. And he would say, understandably, that's a lot of money. The response is to say, for every $100 million you put in, you will get an economic benefit of somewhere between $1 billion and $1.2 billion. And Minister, are you willing to let $1 billion sit on the table and not be gained? So there are all sorts of gains by making these interventions between health and nutrition, taking them from being loosely meshed, which is where they are now, to tightly wedding them to the PSNP. And with that, I know there are some other questions, but I think they're directed to my other colleagues on the panel.